Hi, I'm Ifydika. Welcome back to my channel if you're a returning subscriber, and welcome if you're a new subscriber. Please subscribe right now, don't forget, and hit the bell button so you get notified each time I post a new video. I post new videos every other Friday, so please subscribe. And today with me, I have my friend and my colleague. His name is Fahad. Fahad, say hi.
Hello.
Say hi now. Just tell me a little bit of yourself,
So my name is actually Fahad Wakas.
Okay.
I'm a final year student studying laboratory technology at Radford University. It's here in Accra, which happens to be your beloved alma mater.
Yes, my alma mater.
And
Adding to what Fahad said about himself, I don't know if maybe he's just trying to be very, is it reserved or conservative? What is the word used? But let me tell you about him. It's very interesting.
right. This should be interesting.
Actually, it's nothing he doesn't know. I tell you this thing all the time, Fahad. But let me start with the commonest line he hears all the time. The smartest guy I know. That line, Fahad is
a line that I'm not necessarily proud of. I'm not proud of.
Why are you not proud of it?
You know why already. I mean, that's a topic for another video.
It's a thing of joy, a thing to be happy about.
I don't know. It kind of puts you in a box.
When
guess.
they tell you that you're very smart, how does it put you in a box?
I know a lot of people would want to have such titles thrown at them, and honestly speaking, to be quite frank with you, I don't feel deserving of some of these things people say. I know friends often pass comments like that just to, boost your spirit, and I take it in good faith, but then, it makes you actually sit and reflect and be like, am I actually that guy? And quite often I find myself saying, no, you're not. And
it's
so,
good to be humble. Like, I get the fact that you're trying to be humble, which is
it's quite nice when people have.
You're
nice
actually a
things to
nice
say.
guy, to an extent. It's nice having you here, seriously.
It's nice being here. Thank you for having me. Although I do have a complaint though.
What's that?
The complaint is, when you thought of this topic, right?
Okay.
Was it like, did you go through a list of people? Because initially I was like, was I really her first choice? And then I was like, okay, so wait, what are we actually going to discuss? And then you said it was going to be
actually my
premarital
first choice.
counseling and related to infections and so forth. And I was like, okay, it should be interesting. And then I was like, no, wait, why was I the first person she thought of when this topic came to her mind?
I felt like you could, you'd understand it better.
Right.
Not in a sense of experience or anything, no.
Thank you. I just wanted that clarification out there, so all the people that I know who are going to watch this are not going to be like, so I knew it. You know all of these sorts of things, and it's purely academic.
No.
It's
academic,
exactly,
of course.
it's all theory.
Academic,
It's theory. I know nothing of the practicality of any of these things.
Oh please, these are things we need to put out there anyway. These are things someone has to say it. Someone has to talk about it, so someone has to talk about it. And it being called premarital screening, it being called that, it could also apply to those who are not even ready to marry, because let's be serious, there are people out there having sex, and
of course,
they have to protect themselves, and they also have to protect their partner.
Of course.
So that's why I felt this is quite important, for everyone.
True.
The angle we're actually mainly speaking about, because the angle of premarital, it's a thing people do, so it's kind of like a ritual
Yeah,
But
almost. Yeah.
I'm just saying the ritual could also extend to those who are single and not yet ready
Yes, true.
to, get married.
Actually, there tends to be this sort of stigmatization about people talking about sex unless they are married. And from a
Yes.
healthcare perspective, I think it's actually quite terrible, because then it makes people, be clandestine and secretive about what is going on with them. And they are far less
and then
likely to
when
come
they're
out.
in
Exactly.
trouble,
Yeah, and
they won't be able to.
yes, and more of these
seek
people
help.
tend to wait and wait and wait, and when things are getting out of hand is when they report to a facility where a professional can actually help them along, and by then you've suffered unnecessarily, honestly, quite honestly speaking.
Yeah, true. Yeah, very true. We've been talking about premarital screening. Basically, premarital screening. Okay, let you explain that one. You're telling what premarital screening is all about.
Well,
why we do it and all that stuff.
Basically, the whole context of premarital screening is to look out for certain conditions between a couple that, of course, if you're going to enter into a serious monogamous relationship, you want to know the sexual health of your partner, because we all know the number of transmitted diseases that are in existence, and of course you would want to be certain that whoever it is you are getting married to or are in a serious relationship with is devoid of any of these conditions.
Yeah, and you were speaking about the other individual. What about you as a person? Like, me now. Let's say I don't know why I'm using myself. Let me remove myself from this situation. Hello?
Yeah.
Yeah, like you spoke about, knowing about your your spouse's status and all that.
Exactly.
But then it's also good to know about your own self.
Of course.
Knowing about your own status, even if maybe not for any other thing. At least you know that there are a lot of people that don't know their blood group. A lot of people.
Actually, yes, I was actually unaware of this. I was actually quite unaware of this. It was when we were actually involved in several screenings around.
Screenings, yeah.
Even in Accra, what you would consider an urban setting. A lot of people are completely oblivious to some basic things you would expect they should know.
Yeah.
Yeah, and it's.
And I don't know if maybe because I've always been inclined towards the health aspect,
Right.
but I've always known that this is my blood group right from when I was little.
Right.
My dad and mom made sure that okay, you are
Exactly.
O positive.
Exactly.
But then there are people who, like, I wouldn't say they were not privileged. I feel like they didn't think it as important.
Yeah.
Or
Actually,
something necessary.
Yeah, funny
to
enough,
do.
actually, people tend to think more about their blood groups when it's time to get married, which is funny
Yes.
for some of us, especially those of us who are in the lab and in the medical setting. It's like, so now you are concerned about the blood group you have because you think you may be incompatible with your spouse.
With your partner. Yeah.
Although, in hindsight, that isn't even an issue these days. But I mean, it's something that people still concern themselves with. Exactly, and it was a little weird for me because they tend to worry about the next generation. You're worried about the next generation. I understand.
Worried about their own generation.
Yeah. Like you're alive right now. You're worried about the kid that you may or may not bring into being. You care about. Of course, I understand. You don't want your kid to have sickle cell. You don't want your kid to suffer from a disease that was otherwise preventable. But it doesn't mean you neglect yourself at the moment by not screening for some of these conditions. And mind you, you don't need to screen for STDs just because of your partner. It's always a plus to know your status. Exactly.
Yeah, true. And I don't know, there's this movie that I've seen,
Right.
and it made me, see this stuff as like see it in a different light. In that this lady, she had this whole kit in her house
Right.
to test her partner
Okay.
before and like indulging in whatever activities they want to do. So
Okay.
she brought out a whole test kit with different shapes, and it's like, okay, we're going to do this test and do this test and do this test. I'm going to test you before we can do anything.
And the guy was
I
cool
felt
with it.
that's
And the guy was
actually-
cool with that.
he was cool with that.
Okay.
And I feel like it's actually a wise thing to do, so that, and I also feel like even if when you want to do it, don't just do it for the guy, do it for both of you. So he sees, okay, me too, I'm also clean, you understand? So both of them, they do the test at the same time,
Okay.
and they say, okay, we are both clean,
Right.
and then we can go ahead and
Do whatever. Right.
fornicate. I'm
Well-
definitely taking this part out.
I would wish you would retain it actually, because to all the viewers, we do not condone
Anyway.
fornication. We are just stating it as a fact. It happens. People do it. Not us.
Yeah, we would do it
People
for
do
crying
it.
out loud.
Yeah, people do it.
Anyway, so I don't know if we've talked about like the reasons why we do it and the importance of screening. I'm not sure. I think somehow we've mentioned it, but we've not detailed it out.
Well,
What else?
at the very base of it all, it's that at the very base of it all is that you both are now reassured that both of you are healthy. Now, of course,
Yeah.
this screening, we are talking about screening in the context of diseases that are sexually transmissible. I mean that you can pass
Yeah.
them on by having sex with your partner. But
Yeah.
nonetheless, you should generally be concerned about your health in general, not just diseases that your spouse can contract from you. And I understand that's not the focus
Yeah,
of
true.
our discussion today, but the baseline is for both of you to know that you're healthy.
Yeah. And compatibility too is also part of it. In case they are planning to have children,
Of course, yes.
you know that, okay, we both can bear kids. There's no the time that just imagine if they are both like AS
Right.
genotype, and they're all, oh my god, I'm in love,
Yeah, I
I'm in love with
understand,
you, and we have to marry. Man, are you thinking about your kids? For crying out loud. Because the chances of having a child with sickle cell anemia is 25%, right?
I think it's there's this notion that we have, and I understand it perfectly well because of the part of the world we find ourselves in. In this part of the world, sickle cell is quite prevalent. A lot of people are. I think there was a study I read a couple of days ago which said 25% of the Ghanaian population are carriers of the genotype, and about 2% of all births are sickle cell disease babies. And so there is a deep need for this kind of genetic counseling beforehand. But you see, these sorts of things vary accordingly to the part of the world you find yourself in. For example, where I am from Pakistan, we have cases of thalassemia, which are far outnumber sickle cell, for example, because sickle cell tends to be found more in the West African population as compared. So it depends where you find yourself around the world. You may be in another part of the world, and what you need to screen for more vigilantly is not sickle cell per se, but then another condition that is prevalent among those groups of people.
Okay.
But of course, like I said, in the local context, sickle cell is the first thing that does come into people's minds, and it's for the right reasons because of its high prevalence.
Yeah. And so, speaking of this diseases,
Right.
so what tests are to be done? Um, tests related to this premarital screening. What tests are ideal for
Well,
couples to do before they marry?
right, when you do go see a medical practitioner who is actually supposed to request for these tests to be conducted for you in an ideal situation, they would tend to order these tests in accordance with your history. But generally, they tend to order for the most common STDs that are prevalent in society. And these are the ones that most of the time people hear about most often. Hepatitis B, HIV, syphilis, gonorrhea, chlamydia. These are the ones that people tend to hear most about. In fact, chlamydia is not something people hear so often about. Another one people don't hear so much about is herpes. People hear it every now and then. They don't really know what it is.
I don't think I've been in a lab that they did that test.
Exactly. And depending on the organism that is causing the diseased condition, the tests that are ordered tend to vary. Okay, so the general notion is that the general notion among the public is, okay, it's a disease, it's caused by something. So HIV, everyone seems to know, okay, HIV is a virus. And in light of the recent pandemic, people are more enlightened about viruses. People are a little more knowledgeable now as a result of that regarding viruses. And the way they are tested for tends to vary greatly. And there are so many different ways you could go about testing for these things. But at the same time, there is a difference between what we call a screening test and a diagnostic test. Okay. So what tends to happen most often is people go in for a screening test.
The screening test is actually done for people who are asymptomatic, and by asymptomatic means they don't show symptoms. So the screening test is done for people who actually look healthy. So when it's tested and they find that there's an underlying disease or something, then they go ahead to do a diagnostic test. The diagnostic tests are done for people who have a positive screening test result. So it's used to confirm a specific indication of possible illness.
The key thing to note is that no test is 100% sensitive and no test is 100% specific. And so sometimes we have to run more than one test to be certain about the diagnosis that we are giving out.
Okay. Yeah. So, and adding to the what's it called, the sexually transmitted diseases.
Right.
What are the other tests that people can do apart from tests related to STDs?
Okay, so apart from the STDs, I think the first thing that comes to mind is the sickle cell disease, and so the genotype is something that is quite relevant in this part of the world. But it seems to, if you move to another distinct geographical setting, you would find that the conditions that they have there that are genetic tend to be different. So, for example, in Africa, more specifically West Africa, we have sickle cell anemia. But if you move to another part of the world, like where I'm from, Pakistan, we have rates of thalassemia, which are quite high. And so they tend to screen more for thalassemia as compared to sickle cell. But nonetheless, wherever you tend to find yourself in the world, there are certain conditions that are more prevalent amongst the people of your ethnicity.
Okay.
Yes. Aside that, people tend to also go in for these other tests. I think people still are interested in doing their blood grouping, which is
Yeah.
actually good to know, but it's not as relevant as it used to be in terms of you matching and having children, because there are now drugs that actually do take care of that phenomenon.
Yeah, the Rodam
Exactly.
drug.
Yes. Yes.
Because I feel most people they stress themselves about the RH negative and stuff because
Yeah, the rhesus positive and all that.
before there was no way to go about it, but now it's pretty simple. Once you go for your antenatal, they'll tell you,
Yeah.
okay, you need to do this and do that before and after.
Yeah, be on this drug and yeah, you'll be fine. So
Yeah.
that basically it prepares your immune system not to react against
Yes.
the fetus, and yeah.
And it's done for second pregnancy when the system is already sensitized.
Yes, the immune system becomes sensitized, and it just primes your immune system not to attack the fetus.
Yeah. Hey,
Other than that,
actually,
there are some conditions like hemophilia as well. Sorry to interrupt you. There are some conditions like hemophilia that tend to be. Interestingly, there are cases of hemophilia in our part of the world, but people do not
Yeah.
really screen for such diseases because of how rare they are.
yes, and I didn't even know that. Not like I didn't even know. I know that there are people who have that, but I've just met only one guy, and
Right.
when he said he had it, I was like, oh, interesting. I didn't say interesting anyway. It wasn't in my head.
Well,
I
in
was
your
like,
head, I understand from
Yeah.
a medical laboratory student perspective, it
Yes,
is interesting.
so yeah,
Yes.
because I've not actually met anyone that had it before, so
Yeah.
it felt like what I learned
Oh,
in
okay. So
school
this thing is real. Oh, okay.
came real. Yeah.
Yeah, I get it. I get it. I get it.
Wow. But adding to the STD, not adding to the STDs, adding to the test for the STDs
Right.
and
right.
the blood group. I know that there are other tests that we do. I don't know if I mentioned it the other time, but let's just cover it right now. Like full blood counts. People do that
Sure,
that
of
they
course.
know about their own health status.
Generally,
It
yeah,
doesn't
yeah.
particularly have to do with their spouse to be.
Yeah, precise. Yeah, that's very true. And interestingly enough, in other parts of the world, and I think more so in our part of the world now as well, people are becoming more enlightened about healthcare in general. And so they tend to ask questions about the family history of their spouse as well, to know the prevalence or, I mean, whether there is some condition that is genetic and in the bloodline of their potential spouse. For example, hypertension and diabetes is something that runs rampant in this part of the world. In fact, it's rampant all over globally. And so people tend to now be more interested. Okay, what's the history of breast cancer in your family, for example, or is there any risk of heart disease in your family, and so on and so forth. Yeah, so it goes well above and beyond just the STDs and the FBC. You can be as detailed as you want to be.
Okay,
But then, I mean, of course, you can't exhaust every possible scenario before you decide. Yeah,
that this is the person, because it might not even have to do with what is inside them. It might have to be with individual actually.
Yeah, of course.
Maybe after those tests you want to do, he's clean and all that, but is the person a good person?
Yeah, all those sorts of things that come into play, and you realize that okay, our blood groups are compatible, but we aren't, and then what's the point?
Yeah, I mean that's an issue.
Yeah.
So it should not look as if they've all wasted money. Why did I waste money to do tests? Well, this has been really, really interesting. And And I hope we've tried our best to like explain the things that have to do with premarital screening, and
Yeah.
we've also tried to tell you that you don't have to be ready to marry before you go and test to see, okay, am I okay? Am I fit? Do I need to know
Right.
what are things I need to know about myself? You need to go and check yourself even before
Right.
marriage.
Of
And
course.
if you're engaging in sexual activity, you need to test yourself and test your partner so that you both can be safe. A word you say is
Exactly.
enough advice.
If you would permit me, I would like to just add one thing that just occurred to me,
Sure.
and that's about hepatitis B in particular. Okay.
Okay.
The hepatitis group of viruses are well known, but by far hepatitis B is the one that most people are aware of.
Yeah.
And it would be interesting for you, I'm sure it would be interesting for some of you to know that hepatitis B is far more infectious even than the HIV virus, in that the amount of hepatitis B virus you need to contract the disease or the condition is far smaller, significantly less compared to HIV. And the good news is that it is entirely preventable. There is a vaccine, and I would urge everybody to please go and get the vaccine if you haven't done so already. For the ladies, HPV, human papilloma virus, there is a vaccine for that as well. If human papilloma is left, exactly, if that is left, exactly, it's one of the viruses known as an oncogenic virus, in that it basically means that it can cause cancer in the form of cervical cancer, in this particular case, of course, and it is entirely preventable. And so please take these two particular conditions extremely seriously. Get vaccinated for hepatitis. The ladies get vaccinated for human papillomavirus.
Okay. Thank you so. See, this is why I say he's the smartest person that he's always the smartest in the room. See how he has broken it down, you know.
Thank you for having me. Thank you for having me. I really appreciate you having me.
Anyway, actually, guys, so this actually wrap. We've tried to cover the important points, the things you need to know about premarital screening, and I hope you heed to our advice to go check yourself and go test yourself, go for pap smear, the HPV, or right, you
Yes,
check for.
yes.
You go for your smear. If you are sexually active, go for your pap smear, and make sure you're safe, ladies. Be safe out there, because we have to take care of ourselves in this time and generation. In this generation and time, we need to take care of ourselves. Don't wait till you're ready to get married before you start checking things that has to do with your own body. Okay, so I'm really glad you guys have watched to this extent. Oh, Fahad, thank you so much for
You're
taking out
welcome.
time
You're very welcome.
to join me and
You're very
educate us on this little premarital screening test we just talked about. And hopefully you're going to come back for more other topics. Because you were saying I specifically chose you for this. I'll choose you for other ones too. So
I
hopefully.
will. The next one, I'll actually vet it. I'll actually look at it and be like, We'll actually discuss why you picked me for that one before I come back.
No problem. Thank you so much. Thank you. So thank you guys. Please subscribe to my channel and get notified each time I post a new video, okay? And I'll catch you guys next time. Bye.